Hi, my name is Hannah, and I am one of the 40,000 Canadians each year who have suffered from Clostridium difficile infection, also known as C. diff infection. C. diff causes debilitating pain and diarrhea which can last from weeks to months. Recently, I boarded a plane only to hear an announcement that the washroom was out of service. I had a moment of panic. This was one of my worst fears. My life revolved around having access to a bathroom. Let me take you on my painful journey with Crohn's and irritable bowel syndrome, a journey that was complicated by C. diff infection. Along with being physically debilitating, C. diff infection causes pain and diarrhea. These chronic gut illnesses made my emotional and social life a turbulent nightmare. In school, I frequently had stomach aches that became more intrusive and robbed me of a lighthearted childhood. I had to complete many of my courses at home, socially isolated. I watched life carry on without me, and in my grad year, I felt profound sadness over missing out on lifelong memories. I have spent many years of my life in specialists' offices, emergency departments, and hospital rooms. My 4-year university degree took 6 years to complete. My emotional and physical health plummeted at times. In 2017, after multiple rounds of antibiotics for a suspected bladder infection, I contracted severe recurrent C. diff infection. I was hospitalized, faced possible surgery to remove part of my colon, and I had never felt so ill in my life. I wondered if I would survive this horrific infection. Turns out that my recurrent C. diff infection had a silver lining. I was eligible to receive fecal transplants through a research study. Fecal transplants, also known as FMT, is given by enema. It's a simple and painless procedure in which donors' healthy feces is inserted into my digestive tract. Some people may be grossed out by the idea, but I was desperate to get better, and research studies have found that FMT is 85% effective in curing recurrent C. diff infection. After 2 FMT treatments, my C. diff infection was gone. I still receive ongoing FMT treatments for my Crohn's and irritable bowel, and I am now pain-free and healthy. At 27 years of age, I'm in my final year of my nursing degree, what seemed like an impossible dream when I was ill. Becoming a nurse is becoming a reality. Soon I'll be able to pay it forward for the exceptional care I received from the FMT team, led by Dr. Christine Lee at Island Health. I am also paying it forward by using my lived experience of C. diff infection and FMT to inform FMT research studies. I am also sharing my story in the hope that more people will receive this life-changing treatment. Back on the plane, I remind myself that those fearful days are over. My life is dramatically and positively improved thanks to fecal transplants. I confidently sit back, enjoy the flight, looking forward to my future, full of potential.